Hi, my name is Alyssa Verkamp, and I'm going to be doing my microbiology oral presentation over Legionellosis. So, have you ever went to an American Legion convention in Philadelphia and got sick with pneumonia? Well, this is how Legionellosis acquired its name in 1976. Legionellosis is an umbrella word, and it is used to describe two different illnesses with one term. Legionellosis includes both Legionnaire's disease and Pontiac fever, which will both be discussed in this presentation. To begin, Legionellosis is a type of respiratory infection caused by the Legionella bacteria. The bacteria is commonly found in freshwater environments such as lakes and rivers, as well as man-made water systems such as cooling towers, hot tubs, and plumbing systems. Legionellosis is typically spread through inhalation of contaminated water droplets, such as those generated by a shower or air conditioning system. There are many different species of Legionella, but the most common species that causes illness in humans is Legionella pneumophila. Legionnaire's disease and Pontiac fever are the two different illnesses caused by Legionella bacteria. So, Legionella bacteria is aerobic, meaning it requires oxygen for life and survival. It is polymorphic, which it means it has the ability of to alter their morphology, biological functions, and reproductive modes in response to environmental conditions. Legionella is also monotrichous, which means it has a single flagella at one end or the other, and these are known as polar flagellum and can rotate clockwise and counterclockwise. The clockwise movement moves the organism forward, and the anti-clockwise movement pulls it backwards. Legionella bacteria is also non-spore forming, which means that it's more susceptible to environmental stressors such as heat and desiccation, which is removal of moisture. Additionally, Legionella is gram-negative, which means it's resistant to multiple drugs and is increasingly resistant to most available antibiotics. So first we're going to discuss Legionnaire's disease, which is a severe form of pneumonia that can cause fever, cough, shortness of breath, muscle aches, and headaches. Legionnaire's disease can be severe and may require hospitalization, particularly in individuals with weakened immune systems or who have underlying health conditions. There are several diagnostic tests that can be used to confirm the diagnosis of Legionnaire's disease, which include urine antigen tests, culture tests, polymerase chain reaction or a PCR test, and serology test. Urine antigen tests are the most commonly used test for Legionnaire's disease, and it detects a specific antigen produced by the Legionella bacteria in a urine sample. Culture tests involve growing the Legionella bacteria in a laboratory from a sample of sputum, lung tissue, or bodily fluids. A PCR test is a test that detects the genetic material of the Legionella bacteria in a sample of sputum, lung tissue, or other bodily fluids. And lastly, serology tests detect antibodies produced by the immune system in response to a Legionella infection. The most common treatment for Legionellosis include two different classes of antibiotics, which are fluoroquinolones and macrolides. Fluoroquinolones work by inhibiting the bacterial DNA gyrase enzyme, which is essential for the bacteria to replicate and spread. Macrolides, on the other hand, work by inhibiting bacterial protein synthesis, which prevents the bacteria from producing the proteins needed for growth and replication. Both of these antibiotics can effectively kill the Legionella bacteria and reduce the severity of symptoms in patients with Legionellosis. However, the choice of antibiotic will depend on the severity of the illness and the individual patient's medical history and risk factors. In some cases, a combination of antibiotics may be used to treat Legionellosis. I have included an image here, and it depicts two chest x-rays. The first picture is a normal chest x-ray, and the latter picture is a chest x-ray of someone with Legionnaire's disease. As you can see in the picture of the chest x-ray with Legionnaire's disease, there is a mass in the right lung that is not present in the chest x-ray of a normal person. Pneumonia and Legionnaire's disease often look identical on chest x-rays and depict patchy consolidations in the mid to lower lung, which is shown here. Lastly, we're going to discuss Pontiac fever, which is a milder illness that typically causes flu-like symptoms such as fever, headache, muscle aches, and fatigue. Unlike Legionnaire's disease, Pontiac fever does not affect the lungs and does not cause pneumonia. Pontiac fever is often diagnosed based on symptoms and a history of exposure to the Legionella bacteria. There is no specific diagnostic test for Pontiac fever, and it is often diagnosed through a process of elimination or ruling out other possible causes. However, your doctor may also order urine tests and blood tests, but this is to rule out other possible causes. There is no real treatment for Pontiac fever as it is a self-limited illness, and most people recover without treatment within a few days to a week. Treatment is typically focused on managing symptoms such as fever, headache, and muscle aches. So over-the-counter pain relievers such as acetaminophen and ibuprofen may be recommended to help relieve these symptoms. If someone is experiencing severe or persistent symptoms, or if they have underlying health conditions that put them at increased risk for complications, your healthcare provider may recommend additional treatments or monitoring, and in some cases, antibiotics may be used to help prevent secondary bacterial infections. With Pontiac fever, it's also important to stay hydrated and get plenty of rest while recovering from Pontiac fever. If you have been diagnosed with Pontiac fever, as it's not common to be transmitted from person to person, it can be in rare cases, and it's important to take steps to prevent the spread of Legionella bacteria to others by avoiding close contact, covering your mouth and nose when coughing or sneezing, and practicing good hand hygiene. In conclusion, Legionellosis is a term covering both Legionnaire's disease and Pontiac fever, which are both caused by the Legionella bacteria. Legionnaire's disease is more severe than Pontiac fever and can produce more complications. And again, it is caused by freshwater sources that are seen in everyday life, such as lakes, rivers, and man-made water sources, such as air conditioning. If you or anyone develops symptoms listed in this presentation, consult your local doctor and seek medical treatment. Thank you for watching.